This conference is being recorded. Cette conférence est enregistrée.
Bonjour, bienvenue à notre conférence de presse. Welcome to this media availability. We'll start with Minister Hajdu.
Well, hello, everybody, and thank you very much for joining us here today. I just want to start with a thank you for the Auditor General's overview of the Public Health Agency of Canada's response to the pandemic from the beginning. I will say that this, like all other countries, Canada has been learning, growing, and changing as we've learned more about the virus. And certainly we've invested millions upon millions of dollars into the Public Health Agency of Canada and billions of dollars into provinces, territories, and of course, through direct support purchasing a variety of equipment and therapeutics, including vaccines. We continue to evolve our response as we learn and grow. And I will say that the fall economic statement commits $690 million to the Public Health Agency of Canada to continue to bolster our response. I'll also say that since the beginning of the pandemic, the agency has grown by about 1,000 individuals. This reflects the size and the strength of the agency at this point in time, given the ongoing needs for Canadians of a strong public health response. So we fully accept the Auditor General's findings and, of course, agree with the recommendations that a much stronger focus on public health and pandemic preparedness must be part of Canada's plans now and into the future.
Good afternoon, everyone. I'm William Blair, the Minister of Public Safety. I'd like to begin by thanking the Auditor General for her report, and I was very pleased that the Auditor General recognized the strong response of the Canadian Border Services Agency, and specifically, the Auditor General found that border restrictions were quickly enforced. The CBSA acted quickly to provide guidance to the Border Service officers on restricting entry to Canadian citizens, permanent residents, and essential workers, and that the Public Health Agency of Canada and CBSA worked collaboratively together to develop guidance for Border Service officers and our BSOs. The CBSA had a pandemic plan, which it further developed as the pandemic evolved, and that is the reason why, well before the pandemic was actually declared in Canada, CBSA was able to swiftly implement new measures for our border operations. I'd like to take the opportunity to acknowledge CBSA and in particular, our frontline Border Service officers for their remarkable work throughout this entire pandemic. Since the very beginning, Border Service officers have shown great adaptability in implementing the provisions of 45 orders in council, which were designed to restrict travel and reduce the spread of virus and its variants into Canada. With respect to the Auditor General's report, I want to acknowledge that the consistent application of these new border measures across all ports of entry can be improved. And that's why we accept the Auditor General's recommendations for CBSA. I note that the agency already began, since the auditor concluded her examination last June, to take action to address the deficiencies identified. And for example, they have expanded their support to frontline Border Service officers. They have conducted detailed technical briefings prior to the implementation of new or amended orders in council to support the accurate implementation of the new provisions and ensure clarity for frontline workers. And they are developing a new training tool to further assist frontline officers in understanding the complexities of those orders in council. CBSA will continue to consider the findings and recommendations from this audit report, and they will be informed in all future strategic planning and policies decisions by the advice of the Auditor General. They'll continue to ensure that critical infrastructure and essential services, as well as critical economic supply chains, continue to function normally and as required by all Canadians. And I also want to assure the Auditor General that CBSA will continue to work closely and follow the guidance and advice of the Public Health Agency of Canada and our many other partners in keeping Canadians safe. Thank you.
I think that means I'm up next. I'd like to thank the Auditor General for her review of the Investing in Canada plan, which commits more than $180 billion over 12 years for infrastructure that benefits Canadians. As regards the implementation of the plan, we are on the right track. Over the past 5 years, the federal government has invested more than $81 billion for over 67,000 projects, with 90% of them completed or underway. That means 40% of the way into the plan, we've invested over 40% of the funding. While the Auditor General found that the full budget of the plan was accounted for, she noted that we needed to do a better job of showing our work, and I agree. Talk to any mayor or city councillor across this country about how these projects are improving their community. From new Canadian-made electric buses in Brampton, Ontario, to the new McLaughlin Point water treatment plant on Vancouver Island, to the Net Zero Aquatic Centre in Drayton Valley, Alberta, to new high-speed internet in Eskasoni First Nation in Cape Breton. I have seen these success stories and others on a daily basis, and Canadians must know how their hard-won money is being put to work. We can't just build back better, we have to build back smarter. That's why we've launched engagement on Canada's first ever national infrastructure assessment. We will rely on experts, data, and evidence to identify Canada's infrastructure needs and priorities out to 2050. By getting projects approved quickly, reporting transparently, and focusing on outcomes, we can use our infrastructure investments to promote jobs and economic growth, to improve quality of life for all Canadians, and to drive towards a net zero emissions future. Thank you.
Good afternoon, everybody. It's my turn. Bonjour tout le monde. It's a pleasure to be joining you this afternoon from the traditional territory of the Tsawwassen and Musqueam First Nations. Our government welcomes the Auditor General's independent report on the Canada Emergency Response Benefit and recognizes the importance of its findings and recommendations. It's hard to believe, but today marks exactly 1 year since the COVID-19 Emergency Response Act, which created the CERB, became law. The
CERB was an historic benefit which helped more than 8 million workers and their families pay for necessities like food and rent, at a time when we were asking people to stay home and flatten the curve.
Public servants at CRA and ESDC worked tirelessly to deliver for their fellow Canadians, and we thank them. We all know a Canadian who got support through the CERB, whether that be a spouse, a sibling, a friend, or a neighbor. We delivered this major income support program to help buffer some of the hardest economic circumstances we've faced in a century. And we did it despite not having the usual time required to design, analyze, and implement a new benefit of this size. The public service pulled off this historic feat in a matter of weeks. This report is a testament to the expertise and knowledge within the Government of Canada, as seen in its findings on the level of analysis and advice provided before the launch of the CERB. This due diligence set us up for success, allowed us to make adjustments to the benefit in real time, and ensured it continued to respond to the evolving crisis. Guided by le principe de ne laisser personne de côté,
guided by the principle of leaving no one behind, we continuously looked at how we could better support workers and include more people under the benefits umbrella.
A prime example of this is when we introduced flexibilities to allow workers to make up to $1,000 per month while collecting the benefit. This allowed Canadians to stay attached to the workforce while also bringing in income for their families. And we kept tabs on the trajectory of the pandemic and the related labour market changes, extending the CERB twice, on June 16th and then on August 20th. We were also able to adjust the CERB to develop risk scenarios to identify and detect high-risk applicants. This allowed us to stop payment for more than 30,000 potentially fraudulent applications valued at approximately $42 million. At a time when so many Canadians are making sacrifices, it has always been important that we make sure our support goes to those who really need it. Comme je l'ai dit dès le début,
As I said earlier, we welcome the recommendations in this
Work
report.
is well underway on CERB post-payment verifications. A boost in funding from the fall economic statement will help us take further action to detect, investigate, and address cases of fraud related to the benefit. And lastly, we will be undertaking a formal assessment of the CERB for future reference during an emergency situation where a response and recovery benefit would be needed. This is similar to how we use lessons learned from the SARS crisis of 2003 during this pandemic. As
we move ahead in our economic recovery, our government will continue to be there to support workers. Thank you.
Bonjour à tous, c'est maintenant mon tour et comme on le dit, on garde le meilleur pour la fin.
And we keep the best to the last.
D'être avec
so
vous
I'm very happy to be with you today.
The
Office of the Auditor General of Canada just published 2 reports regarding the Canada Emergency Wage Subsidy and on the Canada Emergency Response Benefit. These measures were introduced by the Government of Canada to support individuals and businesses during this difficult time. As regards the report with respect to the wage subsidy, the agency has had an opportunity to review the OAG's observations and to provide comments on their proposed recommendations. The agency is committed to implementing the recommendations set out in this report by strengthening tax compliance and by using business intelligence to carry out audits. Audits are currently underway and will continue in order to ensure that there is no abuse of the program. With respect to the CERB, the agency is also committed to follow the recommendations of the OAG with respect to the next CRB audit period. The agency will establish an audit plan and will conduct audits at the appropriate time. Although most Canadians respect their tax obligations, it's important to mention that the agency has set up measures to limit fraudulent applications for these emergency programs, and it will continue to do this. Since the start of the pandemic, the agency has been committed to maintaining a balance between making emergency funds accessible to Canadians in need, while at the same time preserving the equity and the integrity of our tax regime. The agency will continue working with the OAG and stakeholders to continually improve its programs and services. And the agency will do so while bearing in mind its service model principles, namely people first. Thank you very much.
Merci beaucoup, Ministre Leboutier. Nous allons maintenant commencer la période de questions. Once we're opening, we'll now start the question period. As usual, 1 question, 1 follow-up. Comme d'habitude, une question et un suivi. Operator, could we please have the first question on the phone?
Thank you, merci. Please press star 1 at this time. If you have a question, s'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. La première question de Raymond Fillon, TVA. La parole est à vous.
TVA, question.
Merci, good afternoon.
Thank
you. Question for Minister Hajdu. How do you explain the Public Health Agency wasn't better prepared to deal with the pandemic last year?
Well, thank you very much for the question. There's quite a bit of reverberation here in my voice, so I'm sorry if I'm sounding a little confused. The Public Health Agency of Canada was a relatively small agency, and in fact, since the report study timeframe has concluded, we've expanded the agency by more than 1,000 employees to date to bolster our capacity in a number of critical areas. And this just reflects, I think, the challenge of such a heavy operational lift without the appropriate level of staffing, the level of expertise. You know, we had about 10 to 12 fully qualified quarantine officers. These are healthcare professionals that have additional 6 months training on the specifics of the Quarantine Act. And in fact, now we have 200 quarantine officers. And of course, recruiting during a pandemic, trying to recruit healthcare workers is a significant challenge as well. But I will say that the agency has learned many, many things about the need to constantly be refreshing pandemic planning, not just within the agency, but certainly driving that pandemic planning as a whole of government exercise.
Now, I understand the agency has grown since the pandemic began last year, but the auditor today says it should have been better prepared at the onset of the pandemic. How come it wasn't?
Well, listen, I think worldwide, there's a challenge in how we balance our investments in health. And coming from local public health, I can say that that's been a challenge at provincial and municipal levels. There's always a need to spend on healthcare delivery, but public health is often not recognized as necessarily an equivalent need. And so I think this is the reflection that the agency and, in fact, the government and governments around the world are having the need to invest in public health, which is about prevention and health protection, and is often the poor cousin of health spending overall.
Thank you. Operator, next question.
Thank you, merci. The next question is from Catherine Lévesque, La Presse canadienne. La parole est à vous.
Presse canadienne, question.
Yes, hello. My question is also for Minister Hajdu. Did the lack of preparation from the Public Health Agency cost Canadian lives in the end?
I can say that the Public Health Agency was preparing from the original indication of pneumonia of unknown, I guess unknown pneumonia. That, sorry, the reverberation's terrible. Can the tech people please help tone that down? Maybe I'm going to try again. Oh, that's much better. Thank you. I can now hear myself think. So when Dr. Tam was alerted to a pneumonia of unknown origins at the end of December, in fact, she began that preparation work that included alerting medical officers of health from across the country and standing up the special advisory committee very quickly so that the country could begin to prepare. Of course, listen, every country, as I said, is going to be reviewing lessons learned, and there will be a full review of the Public Health Agency of Canada and the government's response as a whole. But I can confidently tell you that Dr. Tam and the entire Public Health Agency of Canada knew that this was a health threat to Canadians and knew that we needed to begin our preparations, not just at the federal level, but certainly as a nation. And that is exactly what happened.
And at the same time, it was also, oui, absolument, merci. At the same time, it was also Dr. Tam who had to say that the threat was not low anymore, that the threat was very real and for Canadians. So I'm kind of wondering why it took until March 15th, I believe, for Dr. Tam to chime in and say, look, the threat isn't low anymore. Can you explain why that happened, basically? Thanks.
Well, I think, one of the reflections I've had as a Minister of Health is that there is a difference between individual health threat and country health status threat. And certainly in the early months when we had little to no disease activity, COVID disease activity here in Canada, the threat was indeed low to Canadians, individual Canadians here in Canada. But of course, as we started to see cases rise, that threat assessment was under constant review. And every step of the way, we have listened to our public health leaders, including Dr. Tam. And when Dr. Tam made the assessment that indeed the threat risk to Canadians of contracting COVID-19 was rising, those threat risks were changed accordingly.
Merci, opérateur. Prochaine question.
Thank you, merci. The next question is from Ryan Tumulty, National Post. Please go ahead.
Yeah, hi there. The Auditor General, in the period that she looked at, March to roughly the end of June, found that nearly 2/3 of the people that were supposed to be quarantining, that PHAC couldn't guarantee that they were. I'm wondering, since that time, have those numbers changed? Do you have updated numbers on how effective PHAC is at monitoring people who are supposed to be under quarantine?
Maybe I can start, and I'll maybe ask Bill Blair to add a little bit, because we've worked together on this very closely. In fact, yes, we've seen an improvement of our capacity to be able to do door knocks and direct checks on people quarantining. But I will say that our evidence shows that since April 1st, 2020, when mandatory quarantine was implemented, in fact, 96% quarantine compliance rate, 98% quarantine compliance rate based on law enforcement activity since April 1st, 2020. And, we had over 2 million verification calls since March 8th, over 70,000 in-person visits. So yes, our numbers have increased significantly in terms of contact with travelers, but I will take this opportunity to thank the vast majority of Canadian travelers who did comply with quarantine. And, we're understanding of the need to follow the appropriate mandatory quarantine measures to protect themselves and their communities. I will also say the ArriveCan app has been mandatory since November of 2020, and that ArriveCan app has significantly helped us. Having digital tools like ArriveCan has significantly helped us to monitor people's whereabouts and their quarantine plans, and to be much more thorough and targeted in the way that we use our policing partners who are, really collaborating with us at all levels of policing to make sure that we do appropriate checks on those folks that we feel are at risk of violating quarantine. And I'll turn to Minister Blair to say a few more words.
Thank you very much, Mr. Hajdu. And just in further to that discussion, the Auditor General found quite accurately that as of the end of June, for example, the ArriveCan app only had 7% of travelers using it at that time. We did make it mandatory, exactly as Minister Hajdu said. And now, and I'm very pleased that now we're at 89% of travelers are using the ArriveCan app, which allows us to collect this information digitally. That allows us to share that information with the Public Health Agency of Canada and police of jurisdiction and other law enforcement agencies in order to ensure compliance. And I think there's also very good news. As you're all aware, we've implemented some very significant, rigorous new measures just this year. And for example, we now require people in both land and air modes to provide us with either pre-boarding or pre-arrival testing, so that they must have a negative test taken within 3 days of their arrival at the border. We've also implemented very significant new post-arrival testing regimes for both land and air, and we're following up on quarantine enforcement. And the numbers are very encouraging, and I think it's important to acknowledge. We now measure 99.6% compliance with our testing, screening, and quarantine regimes that are being enforced, and 89% of that's being done digitally. And so there's been a very significant improvement in our ability to measure compliance. I think it's also an opportunity for us to acknowledge Canadian travelers who have accepted these requirements for their return to Canada in order to protect themselves, their families, and their communities. And the level of compliance that we are seeing is very, very encouraging, and it's working.
Follow up, Brian?
Yeah, I'm just wondering, the other thing that was in the Auditor General's report when it came to pandemic preparedness is a real weakness in data collection and data sharing between the provinces and the federal government. It seems like this is something that goes back, frankly, decades. I'm wondering, if you plan some sort of renewed effort to get the provinces and the federal government on the same page when it comes to collecting data on the pandemic, because that seems to have been a real weakness here.
Well, thanks very much, Ryan. And I'll agree, it's been a very frustrating aspect of managing the pandemic. For example, in the early days, we would often get submissions of cases from provinces and territories without anything beyond potentially age, potentially gender, really no disaggregated data whatsoever, and very hard for the federal government to be able to track what's going on. And I'm pleased to say we've come a long way since then, and we've had a lot of progress with provinces and territories and rapid transmission of data on disease activity, on cases, on genomics and sequencing, and a lot of collaboration on tracking the virus in general. And that's in a large part, I think, due to the Safe Restart money that we committed and that we've dispensed to provinces and territories, the $4.28 billion in the Safe Restart that was specifically dedicated for data sharing, improvement, and modernization of data management. In addition to that, of course, the $500 million for rapid support to healthcare systems for provinces and territories, many of them could use and did use that to augment their capacity to get data shared quickly with the federal government and with their other partners. So, there are silver linings, I think, to crises. At least some people see it that way. And one silver lining might be, I think there's a couple. One, that the provinces and territories have rapidly adapted to virtual care, and so have been able to, achieve getting care to people in very, very hard to reach corners of the country. But the second silver lining in terms of healthcare is this improvement in data sharing. Is it perfect? No, but we've come a long way. And I think it certainly has highlighted for all partners the value of having processes and structures in place to share data electronically and quickly.
Thank you, operator. Next question.
Thank you, merci. The next question is from Mary Kay Walsh from the Globe and Mail. Please go ahead.
Good afternoon. Thanks for taking my questions. Minister Hajdu, you seem to be suggesting in your answers that, Canada never had the capacity for preparedness for pandemics, and that this is all kind of new, and then that's why we were so ill prepared. But the Auditor General makes very clear that Canada didn't use the systems that it had created, like the GPHIN. And so I'm just curious as to how you account for that. How do you account for the fact that the stuff that was created after SARS and that was built up in public health was not used to better prepare Canada for the pandemic and to provide actual early warnings on risks, and not a week after the WHO declared a pandemic and a week after Italy was already in a countrywide lockdown?
Okay, I'll take part one of that question. Certainly, in terms of GFIN, I would just steer you to the interim report of the expert panel. The GFIN program issued two different kinds of reports. One, a daily update that does a tracking of all kinds of different stories on diseases or issues of concern that related to health around the world. And secondly, what's called an alert. And indeed, the alert system did go dark, but the alert was actually for international partners. So the daily reports did arrive every day. And in fact, Dr. Tam, as I mentioned repeatedly, and as the interim report confirms, knew at the end of December about the cluster of pneumonia-related cases that were from an undetermined cause, and took immediate action to begin alerting the system, alerting her provincial counterparts, and standing up the beginnings of a framework to respond to what potentially could be quite a significant risk to Canada, and obviously eventually became a significant risk to Canada. So it's really important to understand that although GFIN was not providing those external alerts, and certainly the independent report and the panelists believe that has extreme value to our international partners and to the global public health information network as a whole. Internally here domestically, in fact, those daily reports were continuing, and Dr. Tam was alerted very early on to this unusual occurrence of pneumonias. And so that is when, as I mentioned, her coordination of her colleagues began. In terms of why was the Public Health Agency of Canada not better prepared from a staffing and operational perspective? I think I've been very clear that the challenge, I think, always is around valuing prevention and protection as much as we do the delivery of healthcare, direct healthcare. And certainly, as the Auditor General report indicates, that we have to do both. We have to keep our eye on supporting excellent healthcare delivery across the country, and we have to have a robust public health system at all levels of government, including the federal government. And those recommendations of the Auditor General are a confirmation of what I personally believe as a person who has spent many years in public health at the local level. And I can tell you our government is taking very seriously, which is why you see the massive investment in the fall economic statement of almost $700 million that will go towards ongoing support for the agency's COVID response and for continuing the rebuild of the Public Health Agency of Canada to the degree that it's necessary to protect us from an event like this in the future.
Follow-up, Marika?
Thank you for that response. I didn't hear your explanation for how it was that Canadians were still being told in March that the risk was low. But I need to ask Minister Qualter, I believe, my next questions. I don't know if Minister Hajdu wants to weigh in again after that. Minister Qualter, I'm going to ask you this because my French is not good enough to ask Minister Leboutillier. But can you please speak to the capacity and the type of audits that the government will be doing of both CERB participants and the companies that participated in the wage subsidy to ensure that money that might have been wrongly given to participants or companies is clawed back? What specifically are the plans on that front?
Well, hello, and thanks for the question. I'll focus on the CERB, the wage subsidy. I suspect my colleague can give you a more fulsome answer. ESDC and CRA have been working very closely together for since the onset of this benefit. Post-payment verification activities were always contemplated as an element of the benefit delivery, moving some of the integrity measures to the back end so we could deliver the CERB more quickly within 3 days was definitely a conscious choice on our behalf. And now, as we work to investigate cases for example, on potential fraudulent claims or on people who applied in good faith but didn't actually end up being eligible. We're still waiting for a lot of 2020 taxes to be filed. Madame Leboutillier can tell you a little more detail on the analytics and the investigative tactics, if you will, of CRA, although as you can appreciate, some of that is confidential by design. But we are working on a number of fronts, both to focus first on people who took advantage of vulnerable Canadians and applied fraudulently under mistaken or false identity. And then, of course, just to work very systemically through the CERB applicant role and determine who and just clear up any potential claims that may have been inaccurate or inappropriately applied for. There's an entire process that we knew we would undertake from the beginning, and we are methodically going through that. Diane, est-ce que tu as d'autres commentaires?
Do you wish to make any more comments, Diane?
Oui, je pourrais compléter
Yes, I
concernant
could
la
chime in
subvention
with
salariale.
respect to the
Où,
wage subsidy.
important pour l'agence
It's
du
important for
revenu
the
de pouvoir
agency
trouver un
to
équilibre entre la
strike a balance
vérification et
between
l'accès
audit
aussi
and
de
access
l'aide aux entreprises.
to business support.
Que les
I'd like to
entreprises
remind
étaient
you
vraiment
that
en
businesses
détresse. Donc, les
were
programmes
really
qui ont été mis en
distraught,
place
so
ont vraiment
this wage subsidy was put into
été là pour
place
faire en sorte de
to
garder
ensure
le lien
that we
entre
had
les
a linkage
employés
between
et leurs
employees
employeurs.
and
Et
their
nous avons mis
employer.
aussi des
Keep the employers
des
attached.
sanctions
There
pour,
are
on a
sanctions
abusé là, au niveau des personnes
for
des
those
entreprises qui
people or
recevaient la subvention
businesses
salariale où
who
on peut
applied for the
il va
wage
y avoir des
subsidy.
remboursements s'il y a des gens qui ont fait de la fraude.
If people
Il va y avoir
have
de fortes
committed
pénalités
fraud,
aussi.
there
On
will
parle
be
de
some very stiff
25%
penalties,
de pénalités
25% of the
supplémentaires pouvant aller jusqu'à des
additional
peines
penalty,
d'emprisonnement.
and it could
Donc, au
go.
niveau de
It could
la
even include the jail term.
vérification des
So
programmes
we are
qui ont
going
été
to
mis en
do
place par
audits of
l'Agence
the
du revenu,
programs that were
je peux vous
set
dire
up
qu'au
by
cours
the
des
CRA.
prochaines années, tout sera fait et
Everything will be
pour
looked
faire en
at
sorte de
to ensure
récupérer
that we
des argents
recover
qui sont
the
allés
money
vers
that
des gens qui auraient
went to people
et qui pourraient avoir
who
bénéficié de façon
could have
frauduleuse, mais je peux vous dire que
fraudulently
la grande
benefited from
majorité des
the program.
entreprises,
But the
quand
vast
on a mis les
majority of
programmes en
businesses,
place,
when we
autant
put
au
these
niveau
programs
des
out there,
Canadiens, des
when
Canadiennes,
we
des
try to help
employeurs
Canadians,
et des
employers and
employés,
employees,
étaient vraiment pour aider
we
les
were
gens
there
à
to
passer
help
à
people
travers la
get
période de
through
pandémie.
this pandemic
Merci.
period. Thank you.
Merci, opérateur. Dernière question.
Thank you, merci. The next question is from Christopher Nardi from the National Post. Please go ahead.
The first question, I'll address it to, I guess, Mme Leboutillier, maybe Mme Qualtrough, but Mme Leboutillier, je suis curieux quand même.
I'm curious. The report says that there were that even if you wanted to put measures in place, but that you had problems with the way that your data was presented. Was that a problem that is categorical since the outset of the pandemic? And will it continue after the pandemic if we don't deal with it? What have we done to really deal with this whole data issue problem? Listen, as I said at the outset, the economy shut down on March 13th, 2020, and on the 6th of October, we could start spending money out to Canadians by the 6th of April, rather. We needed to have simple programs that were flexible so that we could meet the needs of Canadians. If we had put so much criteria in place, it would have prevented us from really helping Canadians. So our government felt that it was important for people to be able to buy groceries, pay their rent. We wanted to help people through this pandemic crisis. This is the biggest crisis we've gone through since the Second World War, and we're going to continue working on an ongoing basis. We're going to analyze the programs that have been set up. We're going to ensure that if ever we have another pandemic, or if ever we have to deal with problems arising from climate change, the next event that hits the population, we at the CRA will have our survival kit so that we'll be able to effectively help Canadians and businesses.
And on a somewhat related question to what Marika Walsh was saying just earlier, the plan, according to the Auditor General, is that in 2023, some of the verifications are finished, I think, by CRA March 2023, and then ESDC has a 4-year plan to do post-verification audits or verifications up until 2024. But I want to understand, what does that mean? Does that mean that your audits on both ends will be completed by 2024 at the latest, or is that just we're going to identify the problematic cases and then be able to begin the audits, which generally can be a long and grueling process?
Yeah, I'll start. Thanks for the question. Listen, we have to put in place a multi-year plan, because as people file their taxes, as people's taxes are reviewed by CRA, of course, there may be change. So we need to have the ability legally to continue on with this post-verification work. Of course, the vast majority of it will be done sooner, but we need to have in place the structures to look at these cases. And as you said, some of them will be very complex in terms of particularly the more sophisticated fraud, which we don't even know yet what that could or may have looked like. We needed to put in place a framework, both legal and policy and administratively, to have the runway that's long enough to follow up on all of these, wherever these threads kind of take us, both to ensure Canadians that we're doing the due diligence we promised we would do after the fact, but also to show and learn more about our own kind of risk-based sophistication around mitigation of this kind of fraud.
Thank you. That concludes this press conference. Merci. Cela fait fin de la conférence de presse. Bonne journée.